Hypertension Awareness Series Episode 5A. Good morning. Today we are going to learn about hypertension stages, how we classify high blood pressure. And I'll be basing the discussion on the latest ESC classification of blood pressure. Blood pressure is not just normal or high. It is a continuum of risk. Cardiovascular damage does not start just when the pressure goes over 140/90. Damage to the heart, brain, kidneys, and blood vessels can begin years before hypertension is diagnosed. This is very important to note. For many years, many people were reassured, your pressure is just slightly high. In our setup, pressure iko juu tu kidogo. You don't need to get worried. And then you ignore until suddenly you develop damage. But science now tells us differently. Cardiovascular risk starts rising long before BP goes over 140/90. Blood vessels begin to stiffen early. The heart may quietly start enlarging at this point. Kidney and brain vessels can already be affected. So do not ignore pressure iko juu tu kidogo. And what the latest science tells us is that at that stage, damage can slightly be occurring. The latest hypertension guidelines now talk of a new stage called elevated blood pressure, previously called prehypertension, as a clinically important stage, not a safe zone. This is the best window for prevention. So let us now look at the various BP categories based on the ESC framework. And remember, this will be on the office BP measurements, not home or ABPM. Normal blood pressure is pressure below 120/80. Normal BP less than 120 systolic over 80 diastolic. This has the lowest cardiovascular risk and is the goal for long life heart health. At this level, maintain healthy habits. The next important category is elevated BP. This is BP of 120 to 139 systolic over 80 to 89. 120 to 139 over 80 to 89. It was previously called prehypertension or high normal BP. This level is not harmless. It is not borderline. It is an early disease phase where damage may already be occurring. Don't ignore that stage. Pressure iko juu tu kidogo. So what may already be happening at this stage? The blood vessels start losing their elasticity. Artery linings become unhealthy. The heart may also start enlarging or stiffening early. Do not ignore this stage of elevated blood pressure. Early kidney and brain vessel changes also occur. And the sad thing, you will not feel anything, but your risk is still rising. What studies show is that people in this range of elevated BP range, 120 to 139 over 80 to 89, have higher risk of heart disease and stroke. They also have a higher risk of cardiovascular death in the long term. It is not innocent. Pressure haiko juu tu kidogo. You have a much higher chance of progression to full-blown hypertension. That's why it was previously called prehypertension. And risk rises gradually, not suddenly. So we need to act early at this stage. This stage predicts future hypertension. Without lifestyle changes, many will progress to hypertension within the next few years. But lifestyle changes work very well at this stage. Weight gain, excess salt, stress, poor sleep, inactivity will accelerate elevated blood pressure to full-blown hypertension. And in African population, this progression may occur earlier. Elevated blood pressure, previously called prehypertension, is a warning sign not to ignore. It's there to start initiating lifestyle measures. At this stage, lifestyle is very powerful and will convert the elevated BP to normal blood pressure. Reduce your salt, reduce the processed food, be active, maintain a healthy weight, improve sleep and manage stress. Start acting at this stage. limit alcohol, stop smoking. You can move elevated blood pressure to normal blood pressure at this stage. From elevated blood pressure, we then move on to hypertension. We said hypertension is persistently elevated blood pressure of more than 140/90. Someone was asking how you diagnose hypertension. Repeated elevated blood pressure measured correctly. We will learn about how to measure BP correctly. Repeated blood pressure measured correctly more than 140/90 is hypertension. So BP above 140/90 on a repeated episodes is hypertension. We then grade hypertension to 3 stages: grade 1, grade 2, and grade 3. What is hypertension grade 1? Grade 1 is BP of 140 to 159 systolic over 90 to 99 diastolic. 140 to 159 systolic over 90 to 99 diastolic on repeated measurements. This is definite hypertension. At this stage, obviously, lifestyle modification and medication depending on your cardiovascular risk. We then move to grade 2. Grade 2 is blood pressure of 160 to 179 systolic over 100 to 109. BP of 160 to 179 systolic over 100 to 109 diastolic. At this stage, you are at high cardiovascular risk. It requires medication and mostly more than one drug and lifestyle modification for everyone. We then move to grade 3 or very severe hypertension. This is blood pressure of more than 180 systolic BP to more than 110 diastolic. BP more than 180 over 110. Very high short-term and long-term risk. So you are at very high risk of short-term events: cardiac heart failure, acute kidney failure, acute stroke. So BP of 180 over 110, you need to act fast, requires immediate attention, starting medication plus lifestyle measures. Important note is that classification uses the higher number. Whichever is higher of systolic or diastolic is which you use to classify. For example, BP of 105 over 108 is grade 2. You use your diastolic, which is higher in this case. So use the higher figure to classify. For diagnosis, you need repeated BP measurements, not a single reading. So BP on repeated, elevated BP on repeated measurements. Please note that classification have used office BP measurements. For home and ambulatory BP, you use different cutoffs. So clinic BP, BP more than 140 over 90, repeated episodes, hypertension. If you are using the home BP recordings, the cutoff for hypertension is above 135 over 135 over 85. For home BP measurements, hypertension, BP above 135 over 85. If you are using 24-hour ambulatory BP measures, the average of more than 130/80 is hypertension. Nighttime BP of more than 120 over 70. Home and ambulatory BP measurements are very important. They help diagnose white coat hypertension and masked hypertension, which we will discuss later as we go along. So what guides your treatment decision? BP level plus your overall cardiovascular risk. Remember, risk does not just start at BP of 140/90. We have talked of the new stage of elevated BP, where is when you need to start acting fast. So stay tuned for our next most important episode, where I will talk about the cardiovascular risk, which is very important, not just the BP alone. We will learn how to assess your overall cardiovascular risk. So what can you do today? Check your blood pressure. Know, is it normal? Is it elevated? Or am I in the hypertensive range? Measure your blood pressure if you have not done so. As usual, Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.